Hi everyone, welcome back to the second video of antiviral agent lecture. So in this video, we're gonna discuss on the anti-influenza agents. Influenza is an enveloped virus with a genome made up of single-stranded segmented RNA. The viral envelope is made up of a lipid bilayer that contains three of the viral transmembrane proteins, which is the hemagglutinin, or known as HA, neuraminidase, NA, as well as matrix 2, or abbreviated as M2. So the first step of these influenza virus infections involve the binding of hemagglutinin to salicylic acid residues on the surface of host cells, which results in engulfment of the virus into the cell via endocytosis. Next, the membrane protein M2 forms a pH-gated channels that allow protons to move through the viral envelope and acidify the core of the virus, causing the release of three viral RNAs and proteins, which are then transported into the cell nucleus where viral RNA replication can be occurred. In the nucleus, viral RNA replication is transcribed into messenger RNA. The translational of mRNA into viral proteins take place in the ribosome in the cytoplasm. So once synthesis, hemagglutinin and neuraminidase glycoproteins are secreted through the Golgi apparatus onto the surface of the cell host, where they fuse with the plasma membranes, whereas other viral proteins migrate back to the nucleus where they assemble with newly replicated genomes. Disassembled viral capsids then move to the plasma membrane where it bud off, taking a segment of membrane containing the hemagglutinin and neuraminidase, and thus forming a viral particle. In the last step of replications, a viral neuraminidase enzyme, or NA, cleave this removes the salicylic acid receptors from the surface of the cell, and thereby allowing release and spread of the new virus to the new cells. So there are three classes of approved drug for these influenza infections, which are the M2 proton ion channel blocker that will block the proton influx to the cell to release the viral RNA. Another one is the endonuclease inhibitors and neuraminidase inhibitors. Okay, let's move on to the first agent, which is the M2 ion channel inhibitors. So this group of agents simply work by blocking the M2 proton ion channel and thereby restricting the passage of proton. So these protons are important to trigger the release of viral genes into the host cells. So by inhibit the passage of proton will inhibit uncoating of the viral RNA within these affected host cells, thus prevent the RNA replications. So the drugs that include this class, including the amantadine and rimantadine. So rimantadine is 10 times more potent and more active than amantadine. So both agents is well absorbed and has protein bounds about 67 for amantadine and 40% for the rimantadine. Rimantadine is highly distributed to nasal mucosa and cerebrospinal fluid compared to the amantadine. Amantadine excreted unchanged, meanwhile rimantadine undergo extensive metabolism prior renal clearance. You need to remember that drugs that primarily excreted via kidney should be adjusted the dose if the patient experiences any kidney failure or undergo any hemodialysis or drugs that may induce the nephrotoxicity. So these two agents may cause side effects such as nausea and anorexia, as well as insomnia, and can be worsened, which may cause delirium, hallucination, and seizure due to the alteration of dopamine neurotransmissions. However, due to a high rate of resistance in both H1N1 and H3N2 viruses, these agents are no longer recommended for the prevention of treatment of influenza diseases. Now, moving to the next class, which actually represents a new class of anti-influenza agents called endonuclease inhibitors. So it works in the nucleus of host cells. So let's recap back. Once the viral envelope being acidified and break down the core of the virus, it causes the release of viral RNA and as well as the proteins, which are then transported into the cell nucleus where viral RNA replication can be occur. If you can see in the diagram, there is a cap-dependent endonuclease, which is an essential subdomain of the viral RNA polymerase enzyme. So this cap endonuclease serves as a primer for viral mRNA transcriptions. So baloxavir. Baloxavir is the only agent in this class which works by selectively inhibiting this cap-dependent endonuclease, which is a key enzyme involved in the initiation of influenza virus mRNA synthesis. By blocking this enzyme, baloxavir prevents the viral gene transcriptions and ultimately influenza virus replications. This drug, effective in against influenza A and influenza B viruses, has good oral bioavailability and 90% of it is a protein binding. Unlike other antiviral, this drug excreted via biliary excretion, which 80.1% can be found in the feces. There are not much adverse effects being reported. However, please avoid taking together with antacid or any multivalent ions such as magnesium, calcium, aluminium, which can form a chelate with this baloxavir and then reduce the absorption of baloxavir. Finally, moving on the last class of anti-influenza drugs, that is neuraminidase inhibitors. As mentioned before, in the last step of influenza viral replications, a viral neuraminidase enzyme, or known as NA, will take the main role by cleaving and remove the salicylic acid receptors from the surface of the cells, thereby allowing the release and spread of the virus to the new host cells. So, neuraminidase inhibitors agent of this class exert their antiviral activity by inhibiting the viral neuraminidase enzyme that found on the surface of viral particles. Without this active neuraminidase, the virus is unable to cleave the salicylic acid and unable to escape from the host cells. So drugs that belong to this class include the oseltamivir, zanamivir, as well as peramivir. Oseltamivir is an orally administered prodrug that is activated by hepatic esterase. It is widely distributed throughout the body and has oral bioavailability about 80%. The plasma protein binding is low and can be distributed to middle ear and sinus fluid. The half-life of oseltamivir is about 6 to 10 hours and excreted via renal clearance. Zanamivir is one of the salicylic acid analogs and can be administered directly to the respiratory tract via inhalations, and 10 to 20% of the drugs able to reach the lungs, and the remainder will deposit in the oropharynx. The pulmonary half-life is about 2.8 hours. 5 to 15% of the drug is absorbed and excreted in the urine with minimal metabolism. However, this drug is not recommended for patients with underlying airway diseases such as asthma as well as COPD patients. Peramivir is a cyclopentane analog, has activity against both influenza A and influenza B viruses, which is less than 30% of the drugs is protein bound. Peramivir is eliminated via kidney in unchanged form Dose adjustment is required for renal insufficiency, with the elimination half-life following this IV administration is about 20 hours. The early administration is crucial because replication of influenza virus peak at 24 to 72 hours after the onset of illnesses. This drug will be given for 5-day course of therapy within 48 hours after the onset of illness, which is able to modestly decrease the duration of symptoms as well as duration of viral shedding and viral titer.